get an 80% in your nursing care or your Care 1 assessment by just watching this video to the very end and following these simple things that I'm going to be telling you. You're all aware nursing care or Care 1 assessment is the first assessment that you do as a student nurse. This is usually done in the medical surgical wards, and the first part that you're assessed on is planning and organization, okay? And the most important thing to do in this part, please wear your name tag, be on your school uniform. If it is the scrubs, make sure that they are clean, they are well ironed, just look presentable and organized. And introduce yourself. Most people do not even introduce yourselves. You assume just because you've given us those papers, to give you marks, we know you. No. Introduce yourselves, introduce your assessor and the co-assessor. And this continues even when you go to the patient, okay? At this point, you already know that you need to have at least 5 patients to present to your to your assessor and their co-assessor. That morning, when you go to the ward, tafadhali, kindly go and get the reports. Most of us do not get the report. We are busy tunasoma bado, we are still cramming about those drugs and the questions that you're likely to have. But you miss on the most important thing, getting the report. You need to have the general information about the ward. You need to know how many diabetic patients are there, hypertensive patients, how many surgical patients, how many patients are on theater list today. It is not the management assessment, but these basic things, you need to know them, okay? The other thing about, general information about the ward is the total number of patients. That is so easy. Just have that. Enda kwa hizo statistics, look at them, and even cram them. You need to know these basic things. We are likely to ask you anything from those stats, including number of admissions, how many patients were admitted that night, those kind of things. That's general information about the department. It is good to have that, all right? Now, you've arrived early in the morning, you've taken the report, you've introduced us, now you're taking us to your patient. Introduce us till, okay? And then introduce your patient and give us the history of this patient. Sawa. Now, there's no shortcut to this. Most of us want to go to biodata, then you're skipping to family socioeconomic history, then all of a sudden you've taken us back to past medical surgical history. No, it is not going to happen like that. It has to be systematic. Give us the biodata of this patient. What is biodata? We give us the name of this patient, the age, where is this patient coming from, okay? When was this patient admitted? Is this the first admission and all that, right? Now, then we go to CC. CC is the chief complaint. What brought this patient to, what led to this patient being admitted initially? Who patient anaweza kuwa probably aliadmitiwa na a wound on the leg, I'm on the lower limb, and right now what we are managing is hyperglycemia, okay? What we want is what made this patient get admitted kwanza, and now you can now tell us now, these were admitted because of this, but now you're managing this. That is the chief complaint. The chief complaint, after the chief, we go to HPI, his history of presenting illness. Then you're going to past medical surgical history. Then you're going to family socioeconomic history. And if this patient is in the reproductive ages, like they have not yet gotten to menopause, tafadhali give us the gyne history. That is very important. Sawa. Of course, the next big thing is the physical examination. Now, you do the head-to-toe physical examination. Kila mahali, like, try and give us all of it. And you're like, how is the hair looking? How, the eyes, everything about this patient. But do not major so much on the head-to-toe sana. Just report on what is really important. Dr. Major nayo sana. For example, the patient has been brought to the hospital. They had a gangrene. And now they are going to theater for disarticulation, either nikidole or it's the lower limb or it's the hand, whatever. But the most important thing ni kumeja on what we are really dealing with on this patient. If the patient has pneumonia, you're going to major on the lungs. Okay? Kwa physical examination yako, like, that is what you're going to major on. Yes, you're going to tell us about the toes and all that, but iyo kidole yenye iko, and it is not what you're dealing with. Iliamputatiwa 10 years ago. Please, we do not need a lot of history about that. Just major on what this patient imemleta hospitali, si ndio? Now, please, most of the students, what I've realized, they they don't write about investigations. You're going to give me those papers. Even when I look at the file of this patient, haina investigations. Ama ziko, and then you as the person that is being assessed, you've not captured that now the investigations, there's full hemogram that was done on this patient. I'm believing they are routine investigations. Full hemogram for a patient that is getting admitted is necessary. Okay, the blood panel for that is necessary. Is usually routine. Ni kitu tu itafanywa. If the patient is having a liver problem, we're expecting LFTs. Kidney problems, we're expecting UECs and all that. If they're diabetic hypertensive, hizi zote zitakuwa, si ndio? If they're having heart problems, we're expecting cardiac markers to be there. Now, you need to know those investigations, and as well you need to be able to tell us the indication for these UECs and your patient. Mbona aliandikiwa na daktari afanywe these UECs. If it's the LFTs, the liver function tests, of course, I can probably see the eyes as they are jaundiced. Maybe I can see the skin, or maybe they are diabetic patient. Tell us why you think the LFTs were indicated for this particular patient. The next part is the nursing care plan. Now, this is the most important thing I'm going to tell you about the nursing care plan. Tafadhali, you need to have your care plan at least ikuwe 72 hours. Ni sawa ya nyuma, like the past 3 days. Where most of the students go wrong is you didn't come to see your patient that morning. So now you're telling us about pain. Now your issue ya hii siku, you as a student, mwenye anasesiwa ni uchungu. But when you ask the patient, anakwambia mimi hata niliacha kuumwa jana usiku. And the nurse that was here in the night walikuja na daktari, they prescribed this medicine and I got the medicine. But you, that is what you have in the morning. And now when you gather now, we ask the patient, leo shida ni gani? They're telling us they are vomiting. Make sure umechukua nini ya asubuhi ya mgonjwa wako. Ni sawa sawa. These are the prerequisites. In the morning, ingia angalia mgonjwa wako. Before we come to see your patient, ingia angalia mgonjwa wako. Umeona, after this student, I'm the next person. Angalia your room venye inakaa ya mgonjwa wako. Look at the bed, inakaa aje. Is the bed well made and all those kind of other things. Sawa sawa. Now, I'm not going to go in depth about the nursing care plan. You're watching this from YouTube. There's a link. I already made a video about how to write a good nursing diagnosis and all that. You're watching this from TikTok. Tafadhali scroll down my videos. Utapata there is part 1 and part 2 talking about the nursing care plan, okay? So let's go to part B of this, which is the procedure itself. Mostly the procedures that are assessed at this time in Care 1 are probably drug administration, per oral, IM, subcutaneous, just all the routes of administration. You're supposed to be well versed with all of them. There's wound dressing, there's bed making, there's health messages, especially relating to the patients that you've presented. Mostly zinakuanga hizo, by the way. And, we want to see how prepared you are. How you set your trolley. Yeah, I know sometimes you tume panic sana and the adrenaline is off the roof. And alafu when you're so much panicked, unafanyanga vitu very weirdly. Sindio? You're probably so confused. But try to compose yourself. Get yourself an assistant mwenye atakusaidia like ukue composed. Na ndio maana it's good to prepare for these things together. Like when you get into the department, the most initial things mnafanya iko like muna walk the journey together. Alafu wewe as the bright person that you are, mark someone mwenye ameiva kama wewe tu, so that you help each other in these things. Ni sawa sawa. Set the trolley well. If it's bed making, top shelf, bottom shelf iko imepangwa vizuri. Ni wound dressing, top shelf, like according to the nursing council guidelines. That book is there. The procedure manual is there. Make use of that. I don't see why you should fail a procedure na mnapatiwa 15 minutes ya kwenda kuprepare, 10 minutes ya kwenda kuprepare for a procedure. 5 to 15 minutes. That is a good time for you to actually prepare well for an IV administration, procedure, an IM administration procedure. Prepare your patient. Mwambie you're coming to do this. Okay, now when you get to tumefika pale, now you've already prepared, the environment pia ikuwe poa. We are not coming there and then we are finding gloves on the floor. You lose marks. Utapoteza marks. You come there, you've not told your patient what you're going to do to them. some of us umechukua the needle unataka kunidunga mimi, hata uniambie unafanya mimi nitatoroka. What are you doing? Why are you injecting me? What are you injecting me with? And these patients will make you fail assessment. I'm telling you, if you're not keen, tell them, you know, hey, nimekuja kukupatia dawa ya saa 3 ama dawa ya saa 9 ama dawa ya saa 6. Hii dawa inaitwa hivi, and hii ndio maana nakupatia hii dawa. Like, and don't go to use this English to a patient when unaona kabisa asikii English. Utapoteza marks. Sawa. If you realize there's a language barrier, jaribu kutumia language yenye the patient can understand. So make sure that your nursing mwenye anakusaidia, the assistant is really sharp. Asikuwa amepanic kama hivyo umepanic because you're the one that is getting the marks. Asikuangushe assessment. Kidogo kidogo wamesimama hapo mali sharp box iko. You're going to discard your sharp ako hapo karibu na mdunga. That procedure is not well safe and coordinated. Okay? Remember to document. If anything you do for a patient, document it. Document it right there and then let us see it. If you do not have the file with you, take us to where the file is. But you're supposed to be having the file, especially if you give medication, unafai kuwa na file bedside. Everything inafai kukuwa hapo bedside. You finish and then you document. Of course, I'm not expecting you to be having your file or anything. Probably kama unafanya procedure kama wound dressing, I'm not expecting you to have the file there, of course, because of the contamination and all that. But after you're done with that, tell us that you're going to document. Okay? Mali kwingine we mess up big time, big time, ni ku clear the equipment. Now you've done wound dressing, you're supposed to clear the equipment. Wherever you've taken your trolley, you've taken it to the procedure room. Iko hapo tu. Maybe this patient was not mobile enough for you to go and do this procedure in the procedure room. You've had to do it bedside. The trolley umeiweka hapo kando, sasa wengine watakuja sasa waitoe. Please empty your trolley, clear your equipment. Okay? You finish with the D-packs, zieke mali zinafai kuko. Where are the D-packs supposed to be after you've done your dressing? Hebu nikumbusheni, they're supposed to be where? In the jig. And have knowledge, basic knowledge about the disinfection around. Hata si hapo tu kwa hiyo. Now I'm not even talking about the jig, soapy and clean water. Not even that alone. That is going to be asked if you're doing a dressing as a procedure. But also, like, even when you're doing drug administration, we're going to ask you about the yellow, black, and red bin, if they're present in those rooms. And you need to have those bins in your rooms. If the room that you're going to give medication haina hizo bins, make sure that you carry those bins. They have to be there for waste segregation. We're going to ask you those questions. Okay? Kidogo kidogo, you do not even have the yellow bin. Umetoa gloves, umeweka hapo chini ya trolley. We do what with that? You're going to lose marks. Okay? So let us have a very safe and coordinated procedure. Sawa. Clear your trolley vizuri sana. Okay? In fact, after you've cleared your trolley, you're supposed to call us tukuje tuangalie umeclear trolley. If we do not follow you, tell us, because there is a part that iko na hizo marks. If you look at those papers well, kuna part iko na hizo marks. The next part is communication. Okay? Sasa on the communication bit, please, rapport is very important. So if you've been talking to this patient, you've been preparing this patient that there's going to be an assessment, I don't see why there should be an issue with communication. Wagonjwa wataangusha mtihani kama uja create rapport na wao. I'm telling you this for sure. Okay? So, be accurate when you're talking, be very prompt. Just all the communication skills iko pale. When maybe you're busy pale unatupresentia patient and the patient tries to stop you, anakuambia kitu. Instead of listening to the patient, unamwambia, wewe ngoja kwanza nimalizie, uta lose marks. You listening to that patient is still part of the assessment. So anakuambia, daktari, I'm not feeling, nasikia ni kama sisikii vizuri, ama umekanyanga tube yangu ya oxygen. Na huko hapo unamwambia anyamaze. Mgonjwa kufe tukikufanyia assessment. You see? So this communication is an ongoing, like it's from the time ulianza kuongea na mgonjwa, the rapport you created initially before you even came to see your patient, it's an ongoing thing. And better for you to tell us to wait, you talk to your patient, than to tell your patient to wait, you talk to us. We can wait, but your patient cannot wait. I hope you understand, Mgonjwa ndio ametuleta pale, in as much as umetuleta pale. If that patient was not there, this assessment will not be happening. So your patient unafai unamsikiza to all through. Now, you're probably there, alafu maybe a colleague or another nursing student comes and you're in the middle of presenting this patient, umekuja anakuita, ama relative amekuja anakuita. you're not supposed to tell the relative ati hebu ngoja nafanya mtihani. No. You go and listen to this relative. And this is actually even a management thing, eh? The management assessment iko na hii part sana pia. You listen to what the relative is telling you. Listen to what the other colleague is telling you and delegate appropriately. We do not expect you, now you need to go and do something in the health records department for this relative or for this colleague. Now you've left your assessment, you have gone all the way to do whatever thing to the health records. Ama umeenda theater siju kufuatilia maneno gani ile. Delegate appropriately. Do not ignore any of the persons that come to you. Na ile part sasa ya orals, your favorites. What would you fail to get? How many marks are those? They're supposed to be 21 marks. For the 4 weeks you were in that department, wezi niambia unaweza kosa like 5 conditions zenye umeka kwa kichwa. Asthma, wezi kosa hiyo hata hiyo. Wezi kosa asthma na diabetes na hypertension. Kwa all the others, wezi kosa hizo. Sindo? You're presenting 5 patients. I'm assuming those 5 patients do not have the same diagnosis, right? So then after that, we are talking about specific nursing care management. Now, we are not going to ask you at something that is outside what you have presented. For example, your patient moja alikuwa na diabetes, okay? We're going to ask you about diabetes. We ask you about it. Specific nursing care management of diabetes. Specific nursing care management of a patient maybe you dressed. Okay? The teams that are going to be involved in that is what we're going to ask you. Now, kwa zile dawa zote wagonjwa, we're going to pick one drug and ask you about that drug. Tutachukua dawa mingi, not just one drug. So I'm assuming most of the patients, for those 5 patients, they could be having maybe 20 different drugs. I'm assuming every patient could be having like 4 drugs. It is, if you have to cram, do it, because we're going to ask you about that drug. We're going to ask you about the classification. We're going to ask you about the mode of action. Tutakuuliza tu. That is why this is why we say assessment it's very ni kitu mnaweza fanya as a team. You know, before ukuje kuassessiwa peke yako. Present these drugs to a fellow student of yours. Present these patients to a fellow student of yours. The time you're coming to present to us, it is a walkover. If you're going to present flucloxacillin to a fellow student, umwambia this is a painkiller, they have already told you, yeah, panaki, PAM CEO, that is not a painkiller. Responsibilities. You're not supposed to kuma inje in this one. Okay, you cannot miss out. You cannot miss out. Just say, it's the 5 hours. So, you know, it is the right drug, right patient, right time, right route. You cannot miss on that. Just ensuring those 5 hours are met and observing the patient for any complications. You know, ensuring the patient does not have any, you know, contraindications to administering this drug. And the collaborative management, if you're dealing with a patient, the medical doctor is going to be involved. Physician probably is going to be involved. The surgeon, if this patient is a surgical patient, the surgeon is going to be involved. If this patient is a gynae patient, the gynae is going to be involved. If it's an orthopedic patient, the orthopedic surgeon is going to be involved. Physiotherapy watakuwa involved. If the patient akona, maybe it's a gynae patient, they have lost, they've had a miscarriage or an abortion, psychologists watakuwa involved. Watu wa counseling pale watakuwa involved. Okay, just don't look so far away from where you are. Hapo tu, mgonjwa kwa na kidonda, the next person mwenye atakuwa hapa ni surgeon. Emo lazima kuwa hapo. Every given time, the medical doctor is a constant. I hope to see you in my next video, okay? Bye.